Thank you,
Thank
Dr.
you.
Neha. Thank you, Dr. Manish and the whole
Okay.
team. Now we are moving to our English session. Today is our 2002nd day of continuous webinar. Thank you all the participants who joined here. And before beginning the session, we will have a silent prayer. Today is our 2002nd day of continuous webinar. Today's our guest is Dr. V.K Karunakar. He's MD in Homeopathy, Medical Officer in Government Homeo Dispensary in Nellore, and former professor in the Government Homeopathic Medical College, Kadapa, and is a senior consultant in Karina Homeo Wave, Hyderabad, and Yashodhara Homeo Clinic, Nellore. He have 14 years of experience. And I'm inviting Dr. Karunakar for sir,
Yeah.
Dr. Karunakar, are you?
Yes, ma'am.
Okay. Okay, sir. You are welcome. Please.
Yeah, welcome. Good afternoon, ma'am. Good afternoon to everyone who have participated in this program. Today, I express my clinical experiences on NICC. So why I have to taken up this topic is in the present scenario, day to day. So every parent is worried about their children's. Their children are healthy, their parents are very happy. So not only financially, but entire family environment depends upon the happiness of the family is measured by the children's health mainly. So that's why we have give much more importance to the children's. Here NICC means neonate, infant and child care. So immediately after born, a newborn child is called as a neonate. So after that, from 1 month to 1 year, 1 year age is considered as a infant. After 1 year to 12 years is called as a child. We know very well. So the care about these three stages. Why? What is the importance to take care about our neonate or infant or child in this stage means? So in the present scenario, what I have observed, especially children or neonate or infant, earlier there we don't know what happening, but in the present scenario, so many health issues are developed. Other systems are fails to completely resolving those things and turned into a chronicity. So every almost even we are afraid or surprising, even 3 years baby or even 1 month baby was suffering thyroid dysfunction. Earlier we never heard such type of thyroid dysfunctions in the children's. That means the parentally transforming the gene mutations in that child, or not only that, once they are started earlier, initially a small one, but they are tried. So the WHO also decided in the present scenario, don't use antibiotics for children. But almost all antibiotics were used. So they are exhausted in this. Which antibiotic? They're ready to discover a new one. In those stages, so what is the other alternative method? Everyone has searched about their preserving their children's health. The next scope is they have given priority to the homeopath. This is a unfortunate thing. They came to all other systems are failed to protect their children's health, then come and consult. So immediately they want quick result in their children's aspect. Why? Because if, for example, fever case we can take, we are unable to control the fever within fraction of seconds or minutes. So it turned into there is a chances to develop febrile convulsions. So febrile convulsions is complication, or some other consequences are developed in children. So the parents are worried, and the physician is also worried, and also most of the parents are not brought their child to homeopathy clinic. Why? Because they don't know homeopathy has a scope in the treatment of a neonate or infant or some other things. And also our clinic setups also like that. If you go and visit pediatric clinic, so they are very nicely setup is has done, and their acquaintance with the children is also quite different. We are not that much acquaintance with the children. So that's why here the physician-child relationship, the establishment of the relationship between child and patient, physician is very, very important. So the parents are also have observed how we are examining the child and how we are interrogating the child and how we are getting the information, all other things. So not only physical or pathological conditions are mind related issues. In the present scenario, the most of the issues resulting in the children's is mind. We will discuss later what are the causes or other things. So why I have taken this, is it really homeopathy is a great for NICC or not? If you are asking me, yes, definitely 100% in the present scenario, homeopathy is the only solution for NICC. So not only treating the acute cases, but also treating or to stop the turn or conversion of acute into chronicity of the problem, chronicity and consequences. We have done a research work or survey. Almost out of 100, 50 children are underwent a surgery. Either it may be a tonsillitis, either it may be a adenoids, either it may be a otitis media, or either it may be some other, whatever. So definitely there is a, so in the day to day there is increasing the percentage of underwent a surgical intervention. So definitely we are treating them. We can stop the surgical intervention in those cases. Why? Because either it may be otitis media, adenoids, or tonsillitis. So such a cases are wonderfully cured when you are treated not only in the early stage or later stage, also up to third stage. The clinical stages diagnosed the third stage of one eye, third stage of tonsillitis, or even suppurative or Queen's stage, we are bring back to the normalcy. We can preserve their glands, that means lymph glands, tonsils, and so when we have to preserve those organs, they will protect a children's body in the future. So that is our aim. And also the so many chronic diseases also, even juvenile diabetes, even hypertension we have to observe in the child age only, or different acne, or different cases, not only physical or chemical. So in each stage, so we are creating awareness. Yes, definitely we have a scope in these aspects. They are approaching to us. So even what I have observed, some allopathic people, especially pediatrician, they have read homeopathic science and books. They have to use and they prescribe the drugs for patients. So therein they are prescribing, they are practicing. This is a very, very important aspect to homeopathic. So why? Because the allopathic people are prescribing the drug, their parents also strongly believing. When the pediatrics are referred such a cases to the homeopathic man, so the parents are very interestingly come, they are taking, even something happening, they are giving boost up to, they are waiting for a period of time. So when they are not referred, they are not at all giving even single minute all other things. So that's why homeopathy has a great scope in treating the NICC cases, and even pediatricians are learning homeopathy and prescribing it here and there. Not only I have observed many pediatric physicians are turned into homeopathy. They have used side by side where there is their system of medicine fails. So generally there is a quotation is there, where allopathy fails, homeopathy start, like that. So in these aspects, I also having more opportunities I got when other systems are fails in different stages. Earlier, I have a doubt either we have scope or not. Completely recovery takes place or not. The cases are given. But on experience, what I have gained, there enough I treated. Why? Because there is no alternative. In those in that stage, they have to approach me, and I have review the case and examine the case and analysis the case and interpretation. I have selected a remedies and prescribed to the patients, and they are very nicely recovered. So till now, even more number of cases, I stopped to go to a surgery. Surgical intervention is stopped by our homeopathic prescription in different levels. So not only that, in the ADHD or some other. So that's why the homeopathy has a great scope in compare with all other medical professions to treat the children, not only children, neonate. You have a doubt. So almost most of the people are asking how to administration of the homeopathic remedies in a case of neonate or in a case of infant. If in a case of children, they have habit of chewing the tablets, all other things, they're very easy to administration of the medicine. But in a case of neonate and in a case of infant also up to the 6th month age, they are not introducing any water or solid diet or semi-solid diet. So we have a doubt how to administer. I used only one technique. So any medicine which is indicated for that child. So why? Because the child is unable to. That means neonate is unable to speak, unable to express their sufferings, all other things. So we are only based on objective symptoms only, and whatever the information getting from the objective symptoms means either it may be expression of the neonate and attendant, that means parents history and environmental factors and the expressed objective symptoms in the on the body and the laboratory investigations, either increased CRP level or ESR level or hemoglobin or whatever thing. So when we study clinical materia medicas, clearly mention. So it is suitable for in this ophthalmia neonatal is there. So jaundice is there. So similarly, cyanosis is there. Similarly, anemic condition in neonate or infant or infantile diarrhea, children's diarrhea, so neonatum ophthalmia. So like that, clearly the words which were mentioned in our Materia Medica, when we have a thorough knowledge of them, very easy to prescribe. When you have to give prescribe a simillimum on the basis of similarity, so definitely we bring back. So more quick results and accurate results we have to provide in for these NICC cases when we have proper administration of a right remedy and the repetition of the doses. My technique is simply to take the dilution. I have put on one drop on the dorsum of the hand or on the basis of forehead. So it is only. So based on intensity, I have advised to repeat every second hourly, every 1 hourly, or every third hourly within 24 hours. Later on, daily one dose or up to the 1 week like that. This is only I have used my technique. I used this remedy dilution immediately after born. Also, the patient condition is not good and feeling difficult in taking the breath, all other things, or jaundice. In those cases also, I have given certain remedies like antimonium tart. So antimonium tart is a very good remedy. Why? Because immediately the baby is coming from drowned. This amniotic fluid is act like a fluid. So the baby was drowning in that one neonate. So immediately come back. So they are not cope up with. We have to examine the Apgar score and any defect is there. One dose of antimonium tart administration on the drop of the dorsum of the skin. So it has to stimulate our respiratory system, the neonate respiratory system, and it improves the oxygen metabolisms, all metabolic rates, and the baby is very active. Not only that, it has improves a digestive functions like immediately after any difficulty, the neonate felt taking the feeding, all other things. So these are all different aspects. Or it has prevent the to development of pathological jaundice. Physiological jaundice is common, but not turned into a pathological jaundice, or in physiological jaundice also recovered. So generally, these are the commonest problems. So most of the times, my relatives, my friends, especially my children, here is also one more doubt. Many people are raised. Either are you giving vaccination to these type of children or not? What is your approach? Either you have allowed to take vaccinations as usual or not? This is the biggest question. As per Hahnemannian principle, the vaccines are laboratory serums which are not advisable to the patient. So which are not, or if even you are read in your Metra Medica, the many consequences are resulting after vaccination, either fever, diarrhea, or rash, or sometimes shock also, hazards of vaccination. If you read, there are so many drugs are there. Tuja is there, silicin is there, antimonium tart is there, Crotalus horridus is there, Megerim is there. These are all the different drugs which were having so many characteristics which are resulting after vaccination. So I have doubt. So they are also raised. When I was working as a lecturer or teacher, that all children are raised first question. Either you have to allow your children are vaccinated or not. This is why, because most of the whenever we have to deliver any one statement, either we have ourselves we are following that statement or not. This is a question arising from the minds of the others. Definitely, even patient is also asking. So most of the time, the first question we are facing as a physician, how much experience is there? How many cases you have treated? What is the percentage of care? So how you are treated? These are all the things. So in meanwhile, we are convincing them, we are explaining in a very understanding or comprehensive manner. They are ready to take up our treatment. And once they get the result, they are stick on to the homeopathy, even. So my wish is even small kids are died or a old man, a serious case is died on your hands of homeopath. That is our success. So nobody has raised a question. Even the patient died, the man's of allopathic man or other things. It is simply it is taken as. But once such as some any simple bad things are happening in the hands of homeopathic man, there is a creating so much nuisance. So even now, so many false beliefs or fact or quacks are there, especially in NICC cases. Don't use such a medicines in the NICC cases, or they are damaging the kidney, they are damaging the heart. So there are so many skin diseases are developed. The children are not grown up. While using homeopathic medicines, you should not use any allopathic medicine or like that. You are asking me the same questions. So really, such a symptoms are there in head and they are brought into the surface by prescribing our remedy in earlier manner and treat them and protect the body and improving the immunity. So even I have observed so many cases, the allopathic drugs are worked very quickly after using the homeopathic drugs. So first they are tried allopathic drugs, they are exhausted, again they are come to the homeopathic man. If you are treating homeopathically, they are recovered. So in spite of any situation they are approaching or they are using in same case in allopathic drugs, so compare with earlier, so the quick result they have observed. So what I have getting a statement from my patient, yes doctor, what you said is right, I have observed same manner allopathic drugs are very. So there is no why, because this is a one train track, this is another train track, they never meet in the. So instead of many a times I explain to my patient, so you have used any medication along with homeopathy, but why we should not advise means there is a capability of reducing or curing by homeopathic remedies. What is the need to use other remedies? In that aspect only, we should restrain. Otherwise, nothing. You have to use any drug of choice, anything other thing, and also diet restrictions also is it. So here sometimes it is unfortunate thing, our homeopathic people also, physicians also, whenever such a cases are come to their consultancy, they are their simple negligence, sometimes they are not showing any attention toward that, they are treated as usual. So there is a chances to happening something, that means there is no proper result or adequate result in those cases. So what the patients or parents ideology means, homeopathy, I used homeopathy, but homeopathy fails to give relief. So the thought was spreading more rapidly. So as usual, general, the false news are spreading more quickly or strongerly than the good news is all other thing. So that's why homeopathic man very carefully treating, using such an opportunity whenever we getting. Even till now, the pediatric PG pediatrics established in homeopathic science, but our IPD setups, our OPD setups are not established up to the mark. By seeing the circumstances itself stated that how we have learned. So we are competent with, even integratedly, when we have worked integratedly with the pediatrician, so they are allowing to treat. So many cases, there is a lot of scope is there homeopathic drugs, especially in a case of neonate cyanosis. So many bluish discoloration is that immediately after born, there was no proper metabolic activities, all other things. So what happening? So I already said many cases immediately, even my children are not allowed any type of vaccination except basic vaccination, MMR, immediately after birth. After that, I never allowed. I used miasmatic remedies as a vaccination drugs. So that means in a series of manner, calcareocar, Puja, Mercosal, and Tibericlinum and carcinosin. These are the drugs I used on and off occasionally, along with the permission of even directly I stated to my pediatrician, I never used like that. They are laughing and sleeping and observing nothing is there, so no problem at all. I clearly explained I am a homeopathic doctor. I used this one. I consulting for either my opinion is wrong in that my boy or not. What is the status? Like that, I explained. I convincing them. So I used most of the timings, except one or two instances in high level of fever or some other things. I used paracetamol syrup or some other things. Meanwhile, homeopathy has given a good relief to my children or whoever seeing or believing me. So for them, so it is a great opportunity. So I hats off to homeopathic drugs. So in the cyanosis also some bluish discoloration, this antimonium tar, orsal, carbovage, lacasis, and larocirrus are they have given wonderful result in my these type of cases are fewer in number in my experience. But whatever the case I have taken up in a case of child, in a case of neonate, in case of infant, so very quickly recovered and they are grown well and playing well and they have a good healthy condition. Similarly, in a case of jaundice, I am not explaining what are the causes or pathophysiology or like that. So what I have experienced, how I have taken up the case and how I have treated, those things are explained. In any more other class, I have to show some other videos also there. So jaundice is also there. It is even allopathy, there was no treatment in jaundice except they are keeping under sunlight or infrared light, all other things. So they are unable to. So we have so many drugs there, neonatal jaundice in your repertory or medical description. I used so in few cases a natrum sulf, bryonia, antimonium tar, phosphorus. So these are the drugs in my experience gives a wonderful result. So every day, alternative day, we have checked after administration of this drug, and I have checked jaundice levels, and they are coming down nearly quickly compared with. So this opportunity given by pediatrician in allopathic hospital when I worked as a duty doctor or consultant homeopath in that corporate sector. So this is a great opportunity to get those people are believing and on and off whoever they are not spare of money to the hospital. So those cases are referred to go and use homeopathic drugs like that. Or some people, the management related relatives are there, so they know very well what are the side effects are there by using those drugs. So such a cases are sent to me, and I have taken up and I used drugs in the supervision of the pediatric allopathic pediatrician. They have decided, yes, your drug is very good and this result is there. So this is a great opportunity to observe, to check the homeopathic drugs under the supervision of pediatrics. And so similarly, the agglutination of the leads, these are all the commonest problem. So they are used more number of antibiotics, drops or other things. So, but we are simply treating them and simply removing it from the body. So feeding difficulties also. So either bottle fed baby, so many, whoever the mother is not, we are already known, so many remedies are there for increasing the promoting the milk or balancing the milk. Not only promoting, to reduce, to disappear the milk. For that purpose also we are using our drugs. And here certain in silesia, maybe I think so the baby, the neonate, the baby is unable to feed because of the soreness of nipple or sour mouth, sour taste milk, the bad altered taste of milk. Such a type of, in those circumstances, the baby is dislikes to take fed. So even though normal conditions are there, so silicea is there, Palestilla is there, even artificial fed babies, the any bad effect which is resulting, the alumina is their great drug of choice. Most of the things, either constipation or diarrhea or indigestion, they have developed because of artificial thing, or hiccups, erectations, or bloating. These are all the commonest symptoms they have developed after not proper washing of vessels, using in artificial feeding, or their the mixture imbalance, means adequate water and adequate powder. When there is imbalance between that, they have developed this type of that thing. In those cases, I used the Palestilla. So it is a very good remedy for any altered diet. Administered a new type of diet into after sixth, at the level of 6th month age. So whatever the ailment I have, the baby has developed, I used Palestilla many times, or Silesia, alumina. So these are all maybe colicky pains, or they have developed according to the nature of the symptomatology, Naxwamika, bryonia, or such a things are there. And some oozing of discharge. There is a calcarea pus. Is there any discharge is oozing from the umbilicus or like that? The Arsalb and calendula, these are all. Similarly, rash. So the prickly heat like rash has developed most of the time, even after fever or cold or other thing. So in a case of bronchitis in neonate or children, rubric is there directly in that one. Dulcamera and calicarb is the most. I used many cases. Even allopathic drugs are failed. I used many cases. Dulcamera drops I have to give and administered one drop on the dorsum of the hand. So within 1 day or 24 hours, very good result is there. Calicarb is there. Gestatia, TME, nostril block, any, even sometimes nasal spray fails to give relief. But our TME is more than that. It gives more quick result. When it fails, either maybe sanguinaria nitricum or magnesium more, or these are the drugs which are act very nicely to relieving the nostril blockage and immediately to regularize breathing pattern. So in a case of rash, I used many times belladonna, antimonium. One more drug, Rustax, is also there. I used most of the time. A rash which developed small, reddish all over the body. So sometimes the patient, baby is started to scratch or itch, all other things. And similarly, in the case of neonate, the abnormal develop, when you are examining that one, any congenital malformations also there, means undescended testis is there. So hydrocele, there is a possibility of hydrocele, there is a hydrocephalus or hemangioma or cephalohematoma. These type of conditions are prevailing, or sometimes the large because of zinc deficiency or mineral deficiency, either macrocephaly or microcephaly. Such a type of abnormalities also prevailing in the babies. So in those, what they can do, very different. So we have so many drugs. I have a good experience in a case of hemangioma. One of homeopathic doctor son, aged about 3 months, he has developed the hemangioma on the back of the, just back of the scapular region, back region, scapular region. So they are advised surgery definitely, but the baby is unable to tolerate. So they have referred. The doctor was started to crying, and what I can do in this age, surgery, what are the consequences are resulting, either maybe baby is alive or not. So I was like that. So they are simply asking me, this is the status, what I can do. If you are allowing me, I have treated that case. If it fails, then you go to the surgery. It will take the 3 months time from your surgeon, or 1 month time. It is not an emergency condition. Please take a time. And within 3 months period, I used calcarea carb 30, 200, later followed by medorinum. So these doses, within 3 months, the hemangioma is completely disappeared. That baby age is about 12 years or 13 years now. So completely, even surgeon has expressed how it is possible like that. So this is a thing. Even certain cases, zinc deficiency, microcephaly, zincum metallicum is there, and apis mellifica, hydrocephalus, or cephalohematoma, arnica is a very good remedy, or bellispur is a very good remedy. calcarea carb is a very good remedy. So I used on and off. These are the rare cases, cephalohematoma, hemangioma, or hydrocephalus, or like even children's age or adults also there is a possibility I have used. So most of the timings, the allergic and cough, they are tried allopathic drugs and failed. They have to see which one is alternative appear, or homeopathy is the only source for them. So in those cases, especially cold, rhinitis, bronchitis, and earache, so earache and vatalgia, that means are that may be sleep disturbances in that one. So if you go to the little bit infant, there is a crying. You know very well what is the normal crying or abnormal crying. So why the baby was cried for hungry, thirst, or some inconvenience, diaper, all other things. So for diaper rash also, Bovista is there, arsenic album, phosphorus, sulfur, calendula powder. So many things are there. So simply resolving this diaper rash. So uh, even this hungry, thirst, and pain and diaper inconvenience, these are. But how you know the normal cry is stronger and for few minutes, few seconds, all other thing. But the abnormal cry is so different types of pattern. We don't know the cause sometimes. Maybe colicky pain. Most of the time in colicky pain during colic or during indigestion, the babies are abnormally cry. Or sometimes neurological irritation. Sometimes maybe worms, or sometimes psychological impact also there, but we can't say clearly what is the impact on that one. So how nicely explained in the Metromedica. So most of the time I have treated so nearly 50 cases of like that, this cry, especially the mother won't get a sleep because of the baby was always playing whole night or daytime also. So because of that, the mother health was destroyed. So if baby is not take feeding in a right time and right manner, not go to the bed or sleep in a right manner, so the mother was fed up or exhausted. She has unable to take the diet. She hasn't take proper diet. All other things. So many consequences are developed in the mother also. So here Hahnemann beautifully explained. So one dose you have to administer to the baby, or sometimes another route is also there. What Hahnemann clearly explained, if you want to give a medicine to the neonate, means 1 day baby or 2 days baby or up to the one who are not consuming through oral route. So to give up to the 1 year period also, to give one dose of whatever the indicated medicine for baby condition, to give same medicine to the mother. It is a very, very beautiful. Most of the mothers are asking either I used homeopathy, I am in the feeding stage. So whatever anything happening to my baby are like that. So I explained many times, homeopathy is the safest. You are the only source you are using, not only controlling your health issues or sickness. So it stop the spreading of your infection to the baby. So they are also observing the same time thing. They feel very happy also. So that is the thing. So here Sorinum and Jalapa is there, Sorinum is there, and Lycopodium, Staphysagria. These are all very nicely explained. Whole night, whole day, based on that whole night, whole day and night, and they are not stay alone, very irritable. So Chamomilla, Nux vomica, Sina, Belladonna, Calestilla, these are all the different drugs. They are different types of patterns of Kai. I heard one our senior physician is there at Bangalore. She was prescribing remedies on the basis of sound of the cough or cry of the baby. That much familiarity she has developed to prescribe. So she was sitting in that room, but the received that cry or the sound is coming from the cough. So based on that, she has used either Cuprum metallicum or Spongia or Drosera, whatever the drug. Similarly, either the baby is Jalapa or Sorinum or Lycopodium or stuff. So that very good therapeutic agents are there when we are using simply. For this cry, there was no scope in allopathy. They are simply even the burping and doing, or meanwhile, what they have, so the some painkiller or they have to give. There is no chance of giving morphine or narcotic drugs like adult, but they can wait for some times. So they are just giving painkiller. Because of that, they relieved. So pain. Suppose there was no pain, what happened? So different types of then. Similarly, dentition is there, dentitional ailments. So delayed dentition is there, or dental caries is there. You have to read that creosotum is there, one drug. Even erupted teeth underwent a decade. So whatever the teeth is erupted, the teeth was even calcarea carb. I used many times calcarea carb to regularize the dental pattern. We have to develop according to the age and irregularities in teeth. So the irregularities comes under the uh, miasmatic because of that gum, all other things, the psychotic, all other things, or dental caries, or some irregular pattern, or discoloration. There is a rubric is there in discoloration. Iodine is there, lacosis is there, lycopodium is there. Based on palestilla is there. Based on discoloration, you have to use some little bit, or without losing any enamel, and without their sound teeth has developed according to that one. So even malformations of the teeth also sometimes there is a different. So only one thing is to remove, or sometimes in the present scenario clipping. Because of clipping of teeth, there is a chances to develop pressure in the brain or some other conditions also later. Maybe nobody knows. So similarly, developmental disabilities. So maybe at this stage, even child kid at the 6th month, or in a case of infant, so there is a possibility of refix. In my experience, I treated 2 or 3 cases, rickets. So with medorinum and calcarea carb, completely, even after taking X-ray also, with the normal diet or natural diet, so they are coming to normalcy. They are played well. Or night, so many people are, the few babies or infants are crying because of they are entire day they are playing, and they are started to crying because of cramps at night time. So maybe Rustax or Arnica or belly spur. These are all the remedies to give wonderful results. Or calcarea pass or calcarea floor. So even colicky pains, even attempt to eat. So the baby has developed pain in abdomen, unable to eat. Calcarea pass is the remedy. So like that. So similarly, different behavioral problem. We never say this behavior. So in a case of children, so we are unable to, that means mourning, either very irritable or depressive baby, or so such type of objective expression. Based on that, there was no smile on that one, or objects are thrown. Such a mental behavioral. If you are neglecting in this stage, they turned into later, there is a behavioral problems as well. So in a case of children's also, not only a physical ailments like pains or whatever, outgrowths or swelling or whatever thing, mental problems also, depression, anxiety, or irritability, such a phobias, all phobias. So somnambulism is there, or irritability is there, mania is there, or different type of kleptomania is there, stealing, or desire abnormal things, either charcoal, calcarea carb is there, raw rice, nitric acid is there, or like the different abnormal desires, or there is a farnaceous food, desire furnace. There, so many mothers are complaining about their children. My boy was not taking any food. I asked many times, what is the name? So he never eat, he never take rice. Ex rice, he is able to eat all the things. That is so farinaceous food or junk food. Lycopodium is there. So palestilla is there. Whatever the elements are resulting. So whenever most of the time we have a doubt after administration of the remedy, either such a behavioral problems or such a abnormal disease are reduced, or definitely 100% they are reduced, almost all the things. So in the present scenario, there are social communication. This is most important one. So most of the mothers are complaining, my boy was not mingled with anyone, even except me and their daddy. So they are not talking. Anyone is calling, he never see. They are different. They are, somebody is approaching towards their behavioral pattern is quite different. There is a shy feeling is there, or aggressive behavioral pattern is developed, or sometimes even in the children, child age, either first class or second class or nursery, certain children's behavior is quite different. What well, there are stealing, stolen capacities, there are beating capacities, there are biting capacities, there. So different, there are cruel behavioral patterns are observed in the children's or thrown objects may cause for so many things. In the even sometimes in the present scenario, they are addicted to the mobile. They have developed anti social activities also. Even small kids, 1 year, 2 years age people also, their questionnaire is also quite different towards mother. So why? Because they are raised question, very irritable, aggressive, even not giving anything. Suppose they are habituated to broken objects in the, they're creating nuisance in the house most of the timing, or sometimes they have developed ADHD or behavioral problem, autism children are there. All these, in these cases, if you are treated properly, there is a very good result. Most of our speakers also presented in single what is the scope of autism cases, what is the scope of rhinitis or respiratory diseases or neurological diseases, so neurological irritation or endocrinal disorders. So everywhere, not only a single system, almost how many systems are there, even recently I treated one case, hydrocele is there. By birth itself, the boy has developed swelling, the fluid accumulation in that one, and yeah, another boy has developed that hernial sac is there, congenital process vaginalis is there. So in both cases, the doctor, a pediatrician is advised surgery. So if you go and read magnesium more, one drug is there here, silicea is there for hydrocele, all other thing. I used calcarecarb miasmatically and followed by MAC-carb. So complete resolvence within 3 months. I used that dose is also weekly one dose. One dose calcarecarb, later followed by MAC-more weekly one dose. So you can't expect more result. Even allopathic laxatives are failed. Constipation is a burning problem in the children's constipation. Even they are stand up there. What even in a case of adult, I never heard such type of expression, but how many expressions are described in Metromedica? Lac defloratum, opium, chelidonium, alumina, nitric acid. Even though nitric acid is a diarrheal remedy, but phosphorus. So the different types of nature of the stools also, ribbon-like stool or sheep dung-like stool, or the absolute constipation cases we have to observe in a case of children. Even laxatives are failed. Laxatives are failed. They are tethering even the lacrimation during while passing the stool, or pinching the abdominal muscles like magnesium more, or the knees are strongly bended down and they try to move, or syphilinum, they are adhered, the stools are adhered to the anal canal, they are not easily pass on. Lachesis is there, constriction of the anus, capsicum is there. These things are observed. In adult case, we are quite different. The same drugs are, but were clearly observed in a case of children. Such a type, how many expressions are described in our Metromedica. This is a wonderful opportunity to even laxatives are conjuncted. For a period of time, they are adapted. Again, that may be lead to intestinal paresis also sometimes, intestinal paresis. So they are treated for longer period, this type of laxatives, all other things, there is a chances to develop that one. So you have read, there are so many megacolon, intussusception, volvulus, these are all congenital malformations developed, that there are so many drugs were there in our. And one more important case I have treated in many number of children have suffering with one mesenteric adenopathy, mesenteric lymphadenopathy. So most of the thing, boy was complaining of pain. They tried anti-colic or painkillers, all other things, antibiotic, but failed. Ultimate on ultrasonography, they find out the lymph glands are enlarged. So continuous pain is there. So for the low grade, or sometimes there is a severe pain is also there. So I used calcarecarb is a miasmatic, or belladonna, phosphorus, and naxwamica. So these are all the drugs. You see that rubric is also there. Within 3 months period, the ultrasonography report is coming into a normal. Most of the number of cases, nearly more than 100 cases I treated in my experience, only mesenteric lymphadenopathy associated with the colicky pain and some amount of indigestion. So these are all very nicely recovered, even into susception or anemic conditions also very nicely, lecithin, lecithinum or whatever. So appetite for anorexia, we have to give alpha, some other palestilla, kalium, or all of it. So here, not only physical ailments or mental diseases or social community, shy. So sometimes you have to see observed either borax or acid benzoicum or sepia, palestilla. Their patient is, so they are not leaving their mother hand, or they are clinging to the mother, always clinging to the mother, whatever, even washroom they are clinging. So such type of fears and phobias, or they wants to company, if you are understanding. So for all these things, if you want to, so we are able to treat. So if you want to treat this thing, you have to establish, you have to maintain, there is a physician child communication is more important. Physician, if you are asking my question, yes, you have to allow basic vaccinations in a case of children, and we are able to treat any stage, but we are not established that clinic setup that level, or sometimes there is a chances to fail, we are unable to control, sometimes we are unable to prescribe right remedy or even right remedy sometimes. So the see, even paracetamol syrup they are consumed, the fever is not reduced, even high fever maintained, nothing, they wait for sometimes, even doctor said you are waiting for a period of time. The similar pattern you have to stay, don't wait for some time. This is not the drug failure, this is the nature of the disease, but the parents are not cope up, not listening. Even they are getting more number of problems, side effects, all other things, even repeated appear, they are stick on to that one. They want to have only temporary result, they are not understanding that one. Entire after damage, complete damage of the system, then come to us and they started, how many days we have to use, doctor, please provide, doctor, please provide, doctor. These are the different things. Even mouth breathing is there, so this is, or suckling is there. So many drugs were there, the thumb suckling is there, biting of the nail, so biting of the others. So these are all different types of it. So there are in Metromedica, if you have see, there are different types of child types are there, children types. If you are, if we, either it may be acute case or chronic case. In acute case, very easy to identify the remedy how to give, but everyone is afraid to take acute cases. Why? Because if you are not provided, there is a something resulting as a consequences in that one. So that's why either acute colic, acute rhinitis, or acute. So the gelsimim is there. Rhinitis is a very good remedy. Alimsep, all other thing. Or according to the seasonal wise, also you have to prescribe. My approach is in that in these cases, any objective finding I have to observe, on that base I have to prescribe. Suppose no objective, only common phenomena, common symptomatology is there. I have to inquire about the environmental circumstances. Here, the environmental factors are more important. They are not only initiation, promoting of the diseases, not only physical diseases, mental diseases also. So most of the children, so here, if you have observed, whenever the parents are brought a child, their conversation is quite different. You have to observe. Child is not open up, even they have something inside, but mother was telling all other things. You have to observe the looks or expressions of the patient. So they are stated either mother said is right or not, or sometimes. So their anxiety, mother anxiety expressed the sickness of through intensity of the sickness are like that, but all though they are not a real sicknesses. If you are taken as a consideration, you are mistakenly taken. So that's why always you have to check cross reference or confirmation is more important in that one. So I used in the present scenario, they are always started with compare with in every aspect, height or weight or color or even study, education or mingling or even wanted. Some parents are there because of love and affection. They are always fed their babies, even age acquires. But they are not satisfied. All other babies, their own, their self, their own using eating habit. But my child is not like that. Where is the mistake? She is not habituated. They are not trained the child to every regular habit, but she feels again. She compare with others. In this comparison, so most of the childs also they have some emotions. The purity of their minds are corrupted and suppressed. So in a case of education, in a case of habits, in a case of color and height, so we are creating so much disturbance. So instead of developing courage and motivation in the children, we are creating some inconvenience or negative process in the minds of the children. So it is also earlier stage, it is a very simple, looking like simple, but later it turned into a very, very complex stage. Once it turned or learned as a complex state, very difficult to treat. It is a chronic disease. Once it is chronic disease, so definitely have to treat as a miasmatic manner. That means, so you have to study different types of children are there. Either psychotic child is there, soric child is there, and tubercular child is there. So you have to observe the miasmatic manifestations in the child. You have to identify the diagnosis and all other things. So a few cases are there, but I don't have any time to explain all these things. So in another class, I have to that one. So this may be a small kid, a baby has developed a rash, entire rash. This is whatever I have shown. These are all pure homeopathic babies. They are taking a permission from allopathic gynecologists, and their entire pregnancy they were used our homeopathic drugs even after that. So that's why even small kids was they are brought into that our homeopathic clinic. This baby also pure homeopathic baby. Partly is also resulting from. My screen is audible, visible to you, ma'am.
Yes, yes, visible. Visible but not audible. I cannot hear anything from that video.
This is a baby has developed a rash, ma'am, after fever, after cold. So rash was not subsided, so they are persisting. So I used Dalcamera in this case, followed by calcarea carb.
Uh-huh. Okay, but they are not saying anything, right, in that video?
Yes, ma'am. This is also another case. Father is explained, cough is coming, cough is coming from the stomach. Baby was used abdominal muscles while coughing, and also the nose is blocked. I used calicarb in this case. Bronchitis in children's, and also using that one. This is also another case. These cases are all in Telugu language, our local language, ma'am. Developmental delay is there.
Okay.
So, and also speech, most of the thing, late learning to walk or late learning to speak or late learning, these are all the different types of cases or few more cases also. In another presentation, I have prepared very nicely and according to the case I have think. So, but here what I am expressing or telling you, so everyone feel, even the qualified persons also feels there is no scope in homeopathy or like that. So there are so many drugs are there, lot of scope is there, but we are not using. We are using homeopathy. We are preserving the natural healthy conditions of the baby. Even you are using allopathic drugs, the steroid, all other things, the abnormal personalities. That means obese or some other things. They are not active, have quick alert. So such a abnormals are. So not only in every aspect, maybe a night blindness, maybe there is a thinning of respiratory passages or different types of cases, low birth weight. I have a clear cut picture abratinum child. That baby was died within my hand only, but clear for a few months. A baby was very maintained good condition, but for unfortunately some other reason the baby may be died. I want to show that pic is also abratinum, all other things. So in this only my how we are narrating means a complete as usual case taking pattern examination and physical examination and examination findings and that, but mostly of the timing we are rely on objective symptoms, expressions of the baby or children or infant, and laboratory reports, sometimes pathological prescription also we are able to give. So attendant information, so not completely believing attendant, we have to confirm how, whether in what way, how to explaining all other things. So the speech defects, stammering or speech or different, even height, for increasing height or for increasing weight or malabsorption, even overgrowth. So their gigantism, acromegaly, so endocrinal. So many conditions we have a great scope. So, but unfortunate thing, everything is failed. Then they come to us. So here time takes. Later on, we are there. Also, everyone has created homeopathy is a slow, homeopathy is a slow, homeopathy is a slow, but there is no scope. This is things what I have expressed. If you have any doubt, please rise in this aspect. I try to clarify in level, my level best, ma'am.
Thank you,
Remaining
sir.
so many cases are there. In next part, I try to, whenever another opportunity come, I will explain, ma'am.
Sure, sir. You have to share all the cases. Actually, I'm appreciating you for your courage to take such cases. Nowadays, now every hospital they are making us afraid. Uh, they are telling they are making us fear about neonatal diseases, and I'm
Yes, ma'am. I am also not directly getting, ma'am. There is no scope.
yeah, no
Whoever
scope.
believing a little bit believe, they are giving opportunity, madam. Most of the time, patients are the gods to me.
Actually, we are not even getting the cases because everyone is treating inside the hospital. Then only after coming back from hospital, only they are telling we were 20 days in neonatal ICU because of this complaint, that complaint, jaundice, diabetes, and all. Likewise, they are telling after coming from the hospital. As you said, we are not getting the cases directly. Anyway, I'm appreciating you for your courage to take such cases. And I think we have 2 more minutes. If anyone have any doubt, you can ask to doctor. I think there is.
Recently, I have treated one more case also. One of my relative has delivered prematurely at the age of 7th month. So the baby has low birth weight, 1.5 kgs. So the baby is keeping under missionary only. So they have strong faith towards homeopathy. They are asking, is it possibility is there or not? So okay, there is a possibility. You have to give with this is the route to have administered. Most of the timing, the patients are explaining to me like that. I have to give advice whenever they are NICU setup. I to take the permission of nurse or any other thing to give, or when you are visited to your baby to see, to give one dose of dilution I have provided to them, and they are keeping on the dorsum of the hand. observe the result. We earlier stage and today and tomorrow, no need to have to observe. You are wait just what are the words used by the doctor. That's all. Why? Because they know very well their medicinal action, what type of outcome is there or like that. Then very, very, they are surprising, they are expressing what you can do. They are asking many times what you can do. My patients are explaining to me, they are asking like that, what I can do. Wait for stimulus, nothing is there, your action only. Our aim is to get our baby safe from that side. So that is the only thing. This is the way I have. Or some people are, I worked in a corporate sector. I take permission from pediatrician. In the supervision of pediatrician, I have used sometimes. This is a very great opportunity to me. They are giving chance, and my patients are giving chance to me on strong belief, and they are brought towards me, and they are getting good result.
Thank you so much, sir. Now we have to move to the Malayalam session. Thank you so
Okay,
much
ma'am.
for your
Thank you.
wonderful
Thank you.
and the knowledge. And
Thank
I'm
you.
inviting Dr. Ramparvesha, sir, for giving out of thanks. We already crossed the time. Sir, your order.
Acha. Thank you, Anjane. Congratulations, Dr. V.K Karunakar. Very nice presentation, excellent session. A child health, according to homeopathic is the best treatment of child. So very, very
Dr.
thanks.
Ramparvesha, sir.
Whole IFPH team, thank you.
Thank you so much. Thank you, everyone. See you the same time tomorrow. Good night. And now I am inviting Dr. Anjita for moderating Malayalam session. Thank you, Karnataka, sir.
Welcome. Thank you, ma'am. Thank you.
Okay. Dr. Anjita, you can start now.